nursing and working at Memorial Hermann for almost, this year it'll be 40 years. So I've had pretty much every role there. My most recent role is a nurse navigator, and I've been doing that for about 14 years. And as a navigator, my role is to patients that get transferred in, high-risk OB patients that get transferred into the hospital, I help them navigate through different consults that they may be, having to have, or if they at Hermann, you meet so many people, and so helping the patient know what this physician's role is, and who we are and how we're going to be able to help them through this. And then I also provide feedback for their physicians that have referred them to us, the feedback that what we were doing for the patient, what their outcome is. Because I work with high-risk pregnancies, many of those outcomes are not positive. And so helping those patients be able to grieve that process is what I've been doing, and I've had a passion for it since I started as a nurse. What has really helped me is knowing that when a patient does come in and they've had a pregnancy loss or a newborn loss, is that I know that there's only a limited amount of time that this patient has with their child. And so I want to make the most out of it. Memory making is probably the most important thing. They are going through a traumatic event. They have no idea what they want or what they need. And sometimes they'll say, I don't want anything. And what I try to explain to them is that today you may not want it, but maybe during Christmas or on the anniversary or their due date, they think, oh, wish I had pictures. Organizations like Little Angel Network is so important to families. Many of these families have no idea what resources that is out there for them. Many come in and go home within a 12 to 24-hour period, and so our time is limited as to what resources we can provide for these families. And being able to provide them information on this nonprofit organization is so helpful to them. What I love about this program is that they have different support areas that patients can go through. Some people need a counselor, some people just need, and it is peer-to-peer. Little Angel Network was started from somebody who had experienced this loss, understands what a patient might need, and it's very helpful for patients to be able to network with somebody that has gone through this experience. I call it peer-to-peer support, and being able to help them process through what just happened. When a patient knows that there is an organization out there such as Little Angels Network, they know that they can talk to somebody, talk to another human being, help them with coping mechanisms, and someone that has the time and the knowledge to be able to help them through those processes wherever they may be. Grief comes in stages, and so it's always nice that there's an organization out there that can meet them at whatever stage of their grief that they're going through.